Nearly 3 times the number of people expected to enroll in the Affordable Care Act, or ACA, signed up for health coverage in San Diego County. Here to help explain the challenges and solutions for actually using the new health care coverage is Gary Rado, Health Policy Director for San Diego's Council of Community Clinics. And welcome back, Gary.
Thank you, Peggy.
Nearly 122,000 people in the county have enrolled, and I believe another 200,000 in the county have applied for Medi-Cal and the expanded Medi-Cal programs. Are the clinics here ready to accommodate this influx of patients?
We believe so. I was recently talking with a few of our CEOs, and they have all been working on this change of system delivery, going to a patient-centered medical home, which creates a team functioning with the physician as the hub to be able to provide the services for the patient. And what it also does is relieve some of the physicians from some of the duties that they don't really need to do, and that others, whether it's a nurse or whether it's other members of the teams, can take care of for them. Some of it's administrative and some of it is practice.
Well, we've spoken to a few doctors who've expressed concerns about access to care because of the increase or influx of patients, especially for the Medi-Cal population. Does that still apply, what you just said, to also the Medi-Cal population?
As far as primary care, our clinics feel very comfortable in their ability to be able to expand the services, expand availability, and they have the right teams in place and right systems in place based upon the demand to be able to expand. The question always has been and continues to be, what happens with specialty care? Are there enough specialists that accept Medi-Cal in our region? Historically, that hasn't been so. We're hoping that there continue to be made progress in that regard.
What about the premiums? I know there was some concern also that people wouldn't pay their premiums. Where are we with that?
My understanding is from the health plans themselves is that 85% of those people that have subscribed to a Covered California plan have made that premium payment. They're in good standing. That's higher than I certainly expected. I think that's a very good sign.
Yeah, and this is the first premium.
Yes.
So it will be, as you said, if they continue to pay that.
Absolutely. We're going to have to work together with them to make sure they pay that second premium and that third premium and continue to stay enrolled in good stead with their plan.
Now, the ACA, the number of insured here in San Diego County has dropped the uninsured people here because people have enrolled, and it has dropped the uninsured here by 40%. But as we just heard in an earlier report, immigrants without legal status remain uninsured, even with the new Obamacare. So how is that particular uninsured population, uninsured immigrants, undocumented immigrants, how could that impact this healthcare delivery system?
Well, certainly from the clinic's point of view, we see a number of people and anticipate that there'll still be about 20% of those that come to our clinic that will be uninsured. Whether it's immigration status, whether it's employment status, whether it's other types of status, we don't really know. We just know that we want to try to help not only provide the services, because we're committed to that, but we want to try to get some type of coverage for them so that they won't come to us only when at the last minute they need us. But we want everybody in our community to be able to stay healthy, to be able to maintain their health, if not better their health.
What are local clinics doing to help the newly insured people get the coverage they need, let's say appropriately, and not running to the emergency department?
Well, that's what all of us have to work together. Not only the clinics and not only other providers and hospitals, but the county and the health plans themselves to educate people. Now that you've got a card, here's how you use that card. And here's how you go ahead and access the system and be able to start the plan ahead and make them a true partner in maintaining their health.
So what should the first point of contact be? Should a person call their doctor if they're having trouble? Should they who should they get help from?
Well, the first thing is to make sure that you've selected a physician. Have that phone number and get that contact once you have that with your plan. And the next step is go ahead and contact and find out, call whether it's the clinic or the provider, and talk with the staff and say, I want to find out what to do. Here I am. Do you have a chronic condition? Then explain that and say, I have this chronic condition. Or if you just want to do overall health plan, explain that too. First point of contact is after you make sure that you have a primary care physician is with that office.
Okay, so we're in phase 2 of this now. People have enrolled. Is there a phase 3 issue that concerns you?
Well, a couple of issues concern me. One is we want to make sure, especially the people that are in Covered California, there's going to be a time during the next open enrollment that they're going to need to renew. And this may be new for many people. This is a whole culture change, and we want to help them to maintain their coverage. But we also have the people that now, as I mentioned, have that card, and we want to make sure it's not just now that they're still going to the emergency room at the last moment, but access the care before you need it, get a good care plan, and help them to maintain the relationship with the doctor well ahead when you need the emergency room.
All right, Gary Roto, thank you so much.
A pleasure.